Hi, I'm David Chung, Chief Medical Officer of Joint Pediatric Enterprise of Children's Health and UT Southwestern Medical Center. And welcome to the In the Know video series. Good afternoon. I'm here with Dr. David Troendle, who is an Associate Professor of Pediatrics in the Department of Pediatrics at UT Southwestern and Children's Health. Hi, David.
Dr. Chung, thanks for the invitation to have this discussion.
Oh, it's great to have you here. I was looking very much forward to this conversation.
Well, thank you. I'm very excited to be able to talk today about our program. I think it probably helps to start with some historical perspective. It shows how far we've come and our vision for the future as well. So the foundation for our endoscopy program, I would say, started with the recruitment of Dr. Barth. He's been here for 20 years now, and he came with a vision to expand our endoscopic offerings beyond the typical diagnostic procedures that pretty much all pediatric gastroenterologists around the country were offering: standard upper endoscopy, lower endoscopy. He wanted to offer some therapeutic procedures, and particularly ERCP, a specialized type of endoscopy that allows us to treat diseases in the bile ducts and the pancreas. And he became one of just 5 pediatric gastroenterologists in the country at the time that had that expertise. And he brought that expertise back to children's, which was great. So it really changed the game for us once we were able to offer those procedures under our roof here at Children's Health. And then fast forward 20 years, our division is now up to 32 faculty members, and our endoscopic offerings have grown as well. We offer the full range of diagnostic and therapeutic procedures. Now, not only do we offer ERCP, we offer endoscopic ultrasound, capsule endoscopy, deep endoscopy of the bowel, and not to mention the full array of diagnostic motility procedures. We have a fully functioning motility lab led by Dr. Arina Sangvi, and have recruited a second member for her team. Really exciting to see the growth over the last 20 years of our endoscopy program.
That's lots of great things going on. So, I mean, would you say that we're really uniquely positioned in the country as one of the handful of divisions or programs that can actually offer all this array of various highly specialized endoscopy?
Absolutely, absolutely. There are children's hospitals that are larger than us that still do not offer these full range of procedures, so we're very uniquely situated.
So what does that then translate? How does that translate to sort of what types of conditions and what types of patients that we're able to take care of? We've been, receiving referrals from the region as well as around the neighboring state.
So I'll start with the ERCP procedures that we do here. That allows us to treat a variety of conditions in the bile ducts and the pancreas. And the most common biliary conditions that we treat would be gallstones. And we're able to treat that effectively with ERCP. And then also with chronic pancreatitis. We have a robust chronic pancreatitis program. And being the only center that offers access to that procedure in North Texas, we get referrals from even outside of Texas, Oklahoma, Louisiana, for clearance of the pancreatic duct when it's obstructed.
So I want to kind of delve into that a little bit. So as a fellow GI-focused specialist, what does it mean that we actually have that kind of capability at Children's Hospital versus having adult colleagues in this region or the city who are really incredible endoscopists and have those kind of offerings as well?
Right, so you become more of a complete service for children with chronic pancreatitis. Without ERCP, you are looking at offering medical services, which historically have not been shown to be very effective in children, to skipping straight to invasive surgeries, which may not be appropriate for all children. Definitely some children need that, but there are a subset of patients where there's a middle ground where minimally invasive endoscopic procedures can be helpful.
What are the ranges of sizes of patients and babies as small as, handful of pounds and kilograms that you're able to actually, perform these type of procedure?
That's a great question and an important question. We used to be able to offer ERCP in children all the way down to small infants in the NICU, and the smallest we've done is 2 kilograms. And then obviously we can perform procedures all the way to adult size patients. About 5 years ago, there was a change in the market for duodenoscopes where there was no longer production of endoscopy equipment that would allow us to perform those procedures in the smallest children. And we have been working tirelessly with industry, and actually just got off a phone call with the FDA this morning about working hard to bring a solution back to the market so that we can again offer procedures for those small infants, because right now it's just not an option anywhere in the world.
Well, I mean, that really resonates to innovation. So, I mean, this must be an incredibly hard work, working with the FDAs and trying to bring that back, as well as creating some innovative tools or small devices that actually can be used for small infants, isn't it?
At the end of the day, we don't just want to be innovators, we come here to be healers.
I think that's a very important point, because at the end of the day, it's all about the kids and patients that we take care of, you know? Yeah.
You know, when you're operating in this space of trying to be innovators and early adapters of technology, we feel very strongly you have a responsibility to monitor your outcomes and be critical of your outcomes, because you're in new territory. And so we take this very seriously. And we are still the only children's hospital to have performed a randomized double-blind placebo-controlled trial looking at interventions to try to prevent pancreatitis after ERCP. We are the lead site of a multi-center international collaborative looking at technical outcomes and clinical outcomes in ERCP, so we can know that what we're doing is the right thing for patients. So again, things that we take very seriously.
Well, that's great. I know that you're a superb technician, but I think that I know for a fact, as a first-hand experience of working with GI colleagues as a surgeon, you guys provide incredible service and incredible patient care. So what are the other programs in the division of GI that's being offered?
Yeah, so you know, we're always looking to expand our diagnostic and therapeutic offerings in the endoscopy unit. And so I would say our newest example of this would be our unsedated transnasal endoscopy program. So this will be the first such program in the state of Texas. It's going to be run by Jacobo Santaloya, one of our faculty members. And what the procedure will entail is it'll be an unsedated procedure without any anesthetics applied. We'll utilize a small endoscope. We'll go down the nose, and we'll be able to get all the way to the duodenum and take biopsies. And so what this means for patients is they'll have faster access to the procedures. They'll be cheaper. They won't be exposed to as much anesthesia. It is ideal for those patients who need repetitive endoscopic surveillance of their chronic disease. So for example, eosinophilic esophagitis is going to be ideal for those patient populations. And we look forward to the rapid growth of that program over the coming years.
That sounds great. I mean, you're truly an innovator and a great clinician. Now, you've been here over 20 years?
20 years this year. Yeah.
You were started as a medical student, residency, fellowship.
As I went through my rotations and through the Children's Health System and at UT Southwestern, there's a very clear dedication to development and support of clinical programs to allow us to, not just treat large volumes of patients, but to offer very specialized care. And that's what was attractive to me to stay here and watch this program grow to what it's become.
So what's in the future?
Well, that's a good question. What's in the future? Well, the future is exciting. As you know, there's a lot of blending between surgery and endoscopy, and trying to exploit what can we do minimally invasively now. And endoscopy is well poised to help treat a lot of conditions that historically have had surgical options. The adult world is dabbling in third space endoscopy, which is exciting. We're now getting outside the lumen to treat things, which is interesting. And so that is on the horizon. Yeah,
lots of new exciting innovation. Let's talk a little bit about then, along that line, what about POEM? Is there a role for that in pediatric space? Or maybe for the audience to just kind of elaborate what POEM means?
Sure. So POEM is an example of third space endoscopy. In third space endoscopy, what an endoscopist is doing is tunneling below the mucosa into muscle layers of the GI tract. And there's promising results in the adult world where patients are larger and the equipment's more robust and designed specifically for adult patients. Something we're definitely interested in. Again, whenever you are going to be an innovator or an early adopter, you have to be critical of your technique and what you're doing. So our approach to this initially is going to be partnering with adult colleagues with lots of expertise in this, so that we can learn this technique with them and pioneer and see if it's appropriate for children.
I mean, you're truly an amazing clinician, educator, investigator. You're truly a gem in our system to have you and your talent. And even as a professional colleague working in the GI space, I can't just say amazing things enough about what you bring to the hospital, our patients, and thank you for all that you do.
That's very kind. Thanks, Dr. Chung. I appreciate it.
Thank you for spending this afternoon. Great. Thanks, David.
Yeah, sure.